Good afternoon. Welcome to day 306 at the EMA office with Chairman Kern and Sam Behrman from the Health Department. Sam, it's been a busy day for you, I know, and you've got the numbers, so let's get into them.
So as of today, 227,459 St. Clair County residents have been tested, which is an increase of 1,533 from yesterday. We are at 23,648 positive test results, which is an increase of 169 from yesterday. And that does include both males and females from under the age of 1 up to their 90s. And today our daily county positivity rate is 11%. And we are at 203,811 negative test results. Unfortunately, we are announcing 4 additional deaths today, which does bring St. Clair County's total to 367. We had a male in his 60s, a female in her 60s, a female in her 70s, and a female in her 80s, all with unknown health conditions. And as always, our sympathies go out to their families. For those who have completed the IDPH required 10-day isolation period, we are at 21,174. For state totals, 14,339,584 have been tested, with 1,046,030 positive test results, which is an increase of 5,862 from yesterday. And for deaths, the state is reporting 17,840, which is an increase of 97 from yesterday. For hospitalization numbers in St. Clair County, currently we have 99 patients that are admitted due to COVID-related reasons, and 11 of them are on ventilators. Regionally, we have 181 patients that are admitted due to COVID-related reasons, and 18 of them are on ventilators. For our congregate living facilities that are currently or previously been in outbreak status, please remember these are cumulative numbers and we will only announce any facilities that have had changes. Cambridge House of Swansea has 22 cases and no deaths, and that is an increase of 5 cases for that facility. Four Fountains has 146 cases and 29 deaths, and that is an increase of 10 cases for that facility. Integrity Healthcare of Belleville has 95 cases and 3 deaths, and that is an increase of 6 cases and 1 death for that facility. Integrity Healthcare of Smithton has 69 cases and 10 deaths, and that is an increase of 1 case for that facility. And finally, we have St. Paul's, which has 152 cases and 27 deaths, and that is an increase of 1 death for that facility. For anyone who has not signed up yet, we do have a vaccine notification form that is listed on both the EMA and Health Department Facebook pages, as well as the county page and the Health Department website. You can go to www.co.st-clair.il.us. This is not a registration for an appointment for vaccine. This simply gives us your information so that when we meet your tier and you are eligible to receive the vaccine, we're able to get that information out to you, and we will get that out so you then can sign up for the vaccine itself. So far, we've had 25,860 St. Clair County residents sign up, and that's great. We're hoping to see more. The more people that sign up, the quicker we can get the information out to them when the time comes. And I will turn it over to Chairman Kern for his update.
Thank you, Sam. You know, hospitalizations have not been this low since December 12th.
I know.
And it really, I think, shows that the holidays are a real problem for us. And when I look back at the numbers, we were 3-digit after Thanksgiving. We fell a little bit through December 12th, then all of a sudden, holiday parties, and we got above 100. Today's the first day, so let's keep
Yeah, and I know all of the hospital staffs, you know, they're working as hard as they can to keep staff that are trained appropriately to take care of those, you know, high-risk patients. So, you know, by wearing your mask and socially distancing yourself from those, you know, you're helping those hospital frontline workers out as well.
And they've been going 306 days
They have.
at least, and they've been going longer than we have.
They have.
So, and 24/7. So our thoughts and prayers go out to them, and congratulations, Team St. Clair, to get these hospital numbers down. We'll go into the zip code report. 62201, we go up 5 COVID positives today to 489. 62203, up 1 to 536. 62204, down 1 to 345. 62205, up 1 to 547. 62206, up 2 to 1,086. 62207, up 3 to 503. 62208, up 7 to 1324. 62220, up 19 today to 1,613. 62221 is up 18 to 2,265. 62223, up 13 to 1,415. 62225, up 3 to 120. 62226, up 33 to 2,575. 62232, up 4 to 757. 62239, up 7 to 378. 62240, up 2 to 121. 62243, up 1 to 612. 62254, up 3 to 671. 62257, up 1 to 263. 62258, up 4 to 839. 62260, up 7 to 608. 62264, up 3 to 281. 62269, up 20 to 2,646. And 62285, up 6 to 445. 169 new positives, 1,533 people tested, brings our daily county positivity down again today to 11%, which also brings our 7-day rolling average down to 13.3%. The state has our regional positivity down today to 11.4%. The counties calling in today are Bond, 7.3%, Clinton at 14.8%, Madison, 15.9%, Monroe, 5.6%, Randolph, 5%, St. Clair County is 11.2%, and Washington County at 23%. So hospitalizations down, numbers down. Herb, we just got to keep doing what we're doing. And get needles in arms, and we'll be able to get through this as unscathed as possible.
And we're going to get the needles in the arms. I got all the confidence in the world in our health departments and those that are going to be helping with that next stage of this. One thing I wanted to read, a person sent us this, a citizen from the county last night, and didn't want to come on, but she asked if we would read this, and it kind of fits into what a couple of the comments are being on here now, and kind of what the youth have been talking about the wearing the mask, the social distancing. And this lady writes, I'm a nurse and wanted to share a little story in hopes of pressing on the non-mask wearers the importance of taking COVID serious. I believe I contacted COVID at work and tested positive December the 14th. My initial signs were a slight cough and a tickle in my throat. 2 days later, I lost my taste and smell. The cough over several days became nonstop, and I began having shortness of breath. I also had nasal burning, and intense headache, and extreme dizziness over several days. 9 days into COVID, I had difficult walking due to weakness, severe tremors, and extreme shortness of breath. I however, never had a major fever, nothing over 100.7. By December 22nd, I was diagnosed with pneumonia and was started on inhalers, antibiotics, and steroids. Finally, December 31st, the fever and cough had stopped. The shortness of breath and dizziness improved slightly, but January the 7th, my heart rate shot up to 150, and I developed chest pains. I was diagnosed with a pulmonary embolism, a blood clot in my lung, and now I'm looking at least several more weeks off work and several months of a lifetime on a blood thinner. I don't think some people realize COVID can also leave lingering effects like the cough and headaches, and also including life-threatening problems such as clots or cardiac problems. With all the emphasis on people dying, I never thought about the after effect of those of us that recovered from moderate cases. I hope many of you are the fortunate ones that survived it and returned to be as healthy as ever. There are some that could have lingering problems such as mine. COVID is not like the flu that some say. It affects every part of your body. I try not to be angry, but it honestly does upset me when I see people walking around without a mask on or not covering or just covering their mouth. COVID is not a conspiracy, it's a real thing. If we did our part and followed the guidelines and then get vaccinated when it's time, cases will be much less and maybe less people will be experiencing what I am currently dealing with. Thank you and stay healthy and stay safe. So I just think that's a testament from somebody who has suffered it, and thank goodness that she is doing better, and hopefully the long-lasting symptoms that she happens will subside and she can get back to normal life. And we really appreciate you sending that in to us. She asked that we didn't mention her name because of her employment. But some of the questions that a couple of on her about the mask, well, if people are wearing masks, why are the nursing homes and long-term health care centers still having that problem? I think, Sam, you stressed that. They're doing the best they can. So if you got John's on
You know,
here.
the mask gives you the best chance of not getting it, and that's if both people are wearing the mask. Your chances go down. If only you are wearing the mask and the other person is not, your chances are far greater of getting it than if both parties are wearing masks. Or, frankly, if the other party has a mask on and you don't, your chances of getting it are less. So they're doing a nice thing for you by wearing a mask. You ought to do a nice thing for them by wearing a mask. But still, given all that, people who are both wearing masks, it still can be transmitted. It's just the chances are far less that it will be. So it isn't that anything is 100%, but anything we can do to give ourselves a little better chance of not getting COVID, and frankly, with masks, a lot better chance of not getting COVID, or something that we should do. And now the vaccines are out, and Sam, the health department is working to get people vaccinated. We're in 1A right now.
Yes.
So the doctors, the nurses, all our frontline workers, they're currently getting these shots in the arms. And once we get through with 1A, then the notifications will start because people are signing up to be notified, and we'll let them know when these vaccines will be ready for them so they can make appointments, and we'll get these shots in their arms, and we'll get moving towards getting our life back to normal.
Well, I
Exactly.
think what stirred up a lot of interest in the last 24 hours is a lot of the news media saying that the federal government was releasing all of they had on stockpile. And so we fielded a lot of calls and messages last night and today. What is that going to do to the plan that we have here in the county? And as we've told them, that, you know, we've got to get it here first. And then we've got a plan in place. I know Sam and Mila has just been working today around everything. Every time the phone rings, it's somebody wanting to know when can we get our shots, and you know we got to have the vaccine here in the county, and they've got the plans. That's why that form is important to go on. That is going to help with the logistics of that, as Sam said. So if you know anybody out there who hasn't signed up, you need to really encourage them to do that, because that's going to make it a lot easier, a lot smoother transmission of getting that done.
We've got great cooperation from the hospitals. Team St. Clair is big. There's a lot more of Team St. Clair than not Team St. Clair. So we're going to be utilizing every resource that we have, because bring on the vaccine and we're going to get it out.
Well,
So-
I know yesterday, Sam, you talked with the fire chief, president, association, law enforcement, ILEAS. They're on board. They're sending out, I got copies of the emails that they sent out and said, give Sam this information. So, you know, we're working every minute of the day. We're doing something just the same as we was. You know, we're still needing you to get tested. But we're into the vaccine mode, and we got a lot of that's an undertaking. I mean, it's not going to happen overnight, as we've talked about, but we want to get as many shots in the arms of our citizens as possible. That's the only way we're going to try to get back to some sense of normal. And I know every one of us, all of us who has been stressed and fatigue has set in. I hear those calls. I see the messages. Some of the as Sam and I talk about, some of our senior citizens that call and hear their stories about how they can't wait to get their shot because they want to be able to go out and they want to be able to go to the store and feel comfortable. So sometimes I see tears in Sam's eyes when she comes in and tells me a story about a 90-year-old man that she had to help fill out the form. And but that's because we have compassion for our fellow person, and we want to do that and help everybody. So 306 days we've been here. I wish I could tell you it was the last day, but we'll be back tomorrow for 307, and we'll be back shortly with Cindy and Daisy to translate this into our Spanish communities, and then we'll be back tomorrow. Everybody have a good evening.
We in the medical profession continue the daily battle against COVID-19. One thing I know for sure is that masks do work. Until a vaccine is available, we must ask for your assistance in slowing the spread of this daily virus. 3 simple things help tremendously. Wear a mask, wash your hand, and watch your distance. By practicing those 3 basic principles, you can help us in the medical community respond and defeat COVID-19.